The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. And as you know, we make videos about health and healthcare topics, and you can find all sorts of video. All you need to do is search any topic with Dr. Education on YouTube. In English and Hindi, we have both language videos. Today we are going to talk about vaginal itching and discharge. If you have any kind of itching, discharge through your vagina, this is the video which will give you all the information you need. So this is particularly for women, right? So vaginal discharge is a secretion from the vagina, and this can be either thick, pasty, or thin, right? It might be either of these three, the discharge, or it might be clear, cloudy, sometimes bloody, sometimes white, yellow, or green, right? Or it may be colorless, or it might have a bad odor, right? So itching on the other side, on the skin of the vagina and surrounding area, which is also called vulva, can also be present with this discharge, and this can be present as a separate symptom also. So what causes itching or discharge? See, there are glands in the cervix, right, in the wall of the vagina, right, which normally produce clear mucus, only clear mucus. And this is very common that during childbearing age, women may actually discharge a clear mucus fluid from the vagina, which is very normal during the childbirth, which is also because of hormonal changes due to estrogen hormones, right? So these secretions can also turn white or yellow when they get exposed to air. All right, so this is one thing which you need to remember. Then the amount of this mucus produced varies during the cycle, menstrual cycle, right? So this is obviously because of hormonal changes. That's why during your menstrual cycle there is a lot of changes in your hormones, and that's why the amount changes. So what actually increases your normal vaginal discharge? Number one, ovulation. So the release of the egg from the ovary in the middle of your menstrual cycle on the 14th day, all right, there at that time the vaginal discharge will increase. Number two, pregnancy. And number three, sexual excitement. If you are sexually excited, if you are aroused, then your vaginal secretions will increase. That's normal. Now, there are different types of infections which can cause itching, and they can also cause abnormal discharge from the vagina. And abnormal discharge means either brown color or green color. Yellow or thick white is not abnormal always, and abnormal discharge will have a foul or a bad smell, bad odor, right? This can be associated with itching or irritation as well. What can cause this problem? One, if the infection is spreading through sexual contact, sexually transmitted diseases like chlamydia, gonorrhea, trichomoniasis, right? So these are sexually transmitted diseases which you can have if you had a sexual intercourse, unsafe sex basically, right? Then yeast infections, fungal infections like yeast itself, or it's basically a fungal infection, that can be because of unhygienic conditions, very, very sweaty environments, that can be there. Then normal bacteria which live in the vagina can also outgrow and cause a grayish discharge or a fishy odor. This is itself is called bacterial vaginosis, BV. Bacterial vaginosis is not a sexually transmitted disease. It does not spread by sexual contact, right? This can happen in certain conditions and it's completely treatable, right? Other things are also completely treatable, don't worry. So what else can cause vaginal discharge and itching? Menopause. when your periods are about to end, if you have very low estrogen levels during that period, this can lead to vaginal dryness also, and that's why you can have itching and other like atrophic vaginitis, and therefore sometimes secretions can increase, then dryness, then itching, then secretions can increase, something like this can happen. Then if you actually forgot some tampons or a foreign body inside, then also it can cause a foul odor, right? If you use a tampon, then, right? Then chemicals, these are which are found in detergents, right? Fabric softeners, then some feminine sprays, ointments, creams, douches, or even contraceptive foams and jellies or creams, right? These can have some chemicals which can also irritate the vagina and cause itching and even inflammation around the vagina. So you need to think whether you are using some product there which might be leading to these kind of problems, and stop using them and try whether your problem can gets relieved or not. So what can you do? And obviously there can be some serious and less likely causes also, like cancer. Yes, vaginal, cervical, vulval, uterine, fallopian tube, all of these can have cancers in females, and females should undergo a cervical pap smear whenever they do a health checkup after a certain age, right? In the US it's done mostly after the age of 18, 20s, especially after getting middle age. During the childbearing age they should get, or sexually active age, they should get this pap smear done, right? So certain conditions like desquamative vaginitis or even lichen planus can affect your private parts as well, and they are basically skin conditions, and they can also lead to itching. So for that you will need to consult a dermatologist. So what can you do if you have vaginal itching or vaginal discharge problem? So number one, let's talk about home care, right? One, you have to keep your genital area clean and dry when you have any kind of itching vaginitis. Basically, make sure to seek help from a doctor whenever you feel it's needed, right? Avoid using soap or any kind of cleansing, special cream. Just use water and clean yourself. Then you can soak in a warm hot bath. You can sit in a warm bath. This can also relieve your symptoms, and basically you have to dry thoroughly afterwards. You have to dry the area thoroughly, and rather than using a towel to dry, you may find that a gentle use of warm or cold air through a hair dryer can actually result in less irritation than using a towel, right? So you can use a actual hair dryer to dry that area with a gentle warm or cold air also, right? Then avoid any kind of douching, right? Many women feel that cleaner when they actually douche, but it can actually worsen your symptom because it removes healthy bacteria in the line of the vagina. So in that case, the bacteria healthy bacteria can actually protect you from infections. So you should not douche all the times. Then other tips: avoid using any hygiene sprays, fragrances, or any powders, right? Talcum powders in the genital areas. Use pads, not tampons. Use pads. Do not use any tampons and while you have an infection or while you are on your periods. If you have diabetes, then keep your blood sugar levels in control. That is also an important point. Then allow more air to reach your genital area. For this, you have to wear loose fitting clothes, and do not wear any pantyhoses. That's also important. Wearing cotton underwears is better than synthetic or underwears that has a cotton lining in the crotch can also be helpful. Cotton increases airflow and therefore decreases the moisture buildup, which is good. Or even you can consider not wearing any underwears. That's also an option to you. Then girls and women should also know how to properly clean your genital area while bathing and showering. Then wipe properly after toilets. Always wipe from front to back. This is important. Always wipe from front to back, because from back you can actually spread infection through the anus into the vagina. So that is a very important point. Front to back, not back to front. Right. Wash thoroughly before and after using a washroom, bathroom. Also, you have to wash thoroughly during the infection. Always remember these points. And if you are sexually active, then practice safe sex. Use a condom to avoid catching or spreading any infection. This is important. Alright, then if you feel that you have severe vaginal discharge, you have a lot of pain, fever or pain in the lower belly, or if you feel that you are exposed to some sexually transmitted diseases, then do not hesitate to talk to a doctor, a gynecologist, and get investigated. This is very important. All right, so if you have any sudden change in the amount, color, odor, or consistency of discharge, then go to a doctor. If there is a lot of redness, swelling around the genital area, then you should go to a doctor. And if you think that certain medicine or certain product which you are using can be the reason for this, then still you have to talk to a doctor. Right? These are important. If you have any blisters, any kind of fever or symptoms getting worse in spite of taking care of all these home remedies, right, for at least for 1 week, still you don't get any relief, go to a doctor. So these are the points when you should go to a doctor. Or if you have urinary, burning urination, or there is any kind of sign of infection, then also you should consult a doctor. It's very important. And obviously the doctor will do certain tests, physical examination, medical history, pap smear should be done, right? Vaginal discharge should be sent for microscopy, which is called a wet preparation, which makes us aware what kind of secretion is there, whether it is infective or not, right? Then if there is any skin lesion or skin biopsy can be done if needed, right? And cultures can also be done from the cervical areas by taking a swab. So that will give us an idea what we are dealing with, what the doctor is dealing with, what kind of infection there is, and treatment will depend upon the symptom, the reason, right? So this is the basic which everyone should know about vaginal itching and vaginal discharge. If you like the video, then don't forget to share it and give me a big thumbs up. I'm Dr. Paramjeet and you're watching Dr. Education. Stay connected and stay healthy.